Hello, everyone, and welcome to BizTalk, presented by the South Windsor Chamber of Commerce. Today's episode is sponsored by Crystal Financial Insurance Services, providing insurance and educational services to individuals, families, and businesses across Connecticut. To learn more, check out www.crystalfinancialinsurance.com. Hosting today's episode, I'm Vasanth Kainkaryam, and with us from the South Windsor Chamber of Commerce is Amy Pinard. Today's guest is Dr. Geeta Nayyar. Welcome, Geeta.
Thanks so much, Vasanth. I think you missed your calling. Looks like you should have been doing this instead of being a doc. Pretty
Never
good.
too late. So I'm going to turn it over to Amy to start us off in our conversation today.
Yeah, so why don't we start off by having you tell us more about yourself and what you do?
Sure. So again, thank you, Amy. Thank you, Vasanth. Thank you to the Chamber for having me on. You know, I've had a really interesting journey in my career. I remain really privileged to be a physician, I think, at this time in history and this time sort of in healthcare. Started my journey as an adult rheumatologist and really just found very quickly early on in my career that technology had a lot to offer. So currently serve as the executive medical director at Salesforce. So I'm responsible for bringing a clinical perspective to our products, our solutions into the market, all while still practicing very much like Vasanth and trying to keep us honest about what technology can do and what technology cannot do.
So, as we sort of talk about, technology here, to follow up on a conversation we had a few weeks ago, one of our episodes was talking about diversity. And, the idea of health differs across the world in different age groups and cultures. And particularly with COVID, right, we've seen a lot of trends and patterns that are different. Why is it important to look at different groups of people, different populations from a health perspective? And what role does technology have in that?
Sure. So, all of us are genetically predisposed to certain things, right? I come from the South Asian community, similar to the South. We have a predominance of diabetes, hypertension. We also have certain cultural norms in terms of our diet, our lifestyle. And so, here I practice in South Florida in Miami, telling a Latin family that they can't have rice and beans, if they're diabetic, pretty much ensures you're going to have a non-compliant patient, right? You're not really helping that patient if you can't tailor their treatment plan or their lifestyle and education around their disease to their actual daily life and their daily routine, which is very much influenced by the culture that we all come from. So I think you have to be very intentional about it, right? Both as a physician, in business, I think in life, I think we're seeing that play out across the world, certainly here in the US. And so being really intentional and having that conversation and tailoring your treatment plan to that, right? So the diabetic lifestyle and diet for a Latin American family might look different than a South Asian family, might look different than an African American family, and just being cognizant of that, because again, it is about a partnership, patient and doc, and it's, if you want your patient to actually be successful, if you want to be successful, I think it's important to be very deliberate about the way we incorporate cultural norms into the treatment plan.
And as we've sort of seen this sort of new plethora of technologies, right, coming through, you have these thermal body scanners, you've got, people entering their jobs, and, you go up to a little device that tells you, if you're good to come into work that day or not. Is this going to be our new norm? Do you think that, these technologies are here to stay? And what else do you think might be coming out of all this?
Sure. So, I'd like to think that at some point COVID-19 will go away and we will go back to what I like to call the new exceptional, not the new norm, right? And to me, the big thing that I think is here to stay is safety first, right? Very similar to how, we saw the airport industry TSA change after 9/11, right? Safety got beefed up, new guidelines, new requirements. It was essentially the standard went up a notch, right? And so I think we're going to see that across every employer, every consumer mindset. It's about safety first, whether that's temperatures today and tomorrow. It's everybody needs to be aware of flu season and the flu shot and washing your hands in a way that we never have before, and the culture around sickness, right? Stay home. Don't power through it and be the employee that's sick and comes to work and gets everyone else sick, but you showed your boss that you're dedicated, right? So I think that piece of it has changed. And I think employee health and wellness has taken a seat at the table in a way that it never had, right? And when we look at, even before COVID-19, we look at employee productivity, the cost of healthcare to employers, the cost on employees, how are we treating, women in the workforce, right? And how do we actually empower those women to be successful and also to be caretakers in the home, which they continue to be in every household. So I think those things are here to stay. The nuances of temperatures, all of that. I'd like to think that'll pass with COVID-19, but this mindset of safety first, I do think we're in a different paradigm, and hopefully that's here to stay.
And so we're talking a little bit about employee health, and I want to touch on that just a few minutes more. You have a lot of employees, working from home. You have, fitness centers that are at, fractions of the capacity that they're actually built for or that they could handle. So as an employer, as a small business, thinking about employees and, what if your employee gets sick, loss of productivity and things like that, how do you see that changing, and how do you see technology influencing the way employers should think about their employee health initiatives?
Sure. I think that's a great question. And I think it's what's playing out now, right? So it's about getting creative. It's about getting creative about schedules, creative about culture of, my 8-year-old visits my whole team. My whole team knows my 8-year-old, right? So it's this culture of, we are in this together. We all have our own challenges. Every household is different. And how do we make sure that the employee that wants to actually be productive and continue to work can do it within an acceptable culture and environment that allows for that, allows for children to walk into a meeting. At Salesforce, we certainly have that. Our CEO says, if your kids walk in, sit them on your lap and go on with your meeting, right? So I think part of it is acceptance, and the technology is there to enable the culture, to enable the work. But the people part of it and the cultural part is the part where I think there's an opportunity to embrace, right? Understanding, different workforce challenges for men and women, different caretaker responsibilities, off hours, right? Being open to, hey, maybe I can't join this conference call at this time, but I could do it then, or I will get the work done. I just can't hop on the call. Can we do this via email? Can we do this via text? Can we do this via chat? So I think we've seen that change. I also think that in sales, right? I don't know that business travel will ever come back the way that it was before, because we're finding, financial efficiencies. We're finding that employees, everyone is saving money. And now we have customers and clients that don't expect you, right? Before, there's kind of this cultural expectation. If you want to sell something to me, you have to come to my office, right? But you're the doc. If you want my services, you need to come to my office. You need to wait in my waiting room. Right? All of that's been flipped on its head. It's now patients want to be safe, employees want to be safe, customers want to be safe. So stay where you're at. I'll stay where I'm at. And there are any number of technologies we can use to engage and get the business and the work of the day done, right? All while still empowering individuals to be able to be safe and also live their lives. And I do hope that piece of it is here to stay. That said, Vasanth, I would love to grab drinks with you. I'd love to have dinner with you when this thing is over, right? I want to meet the baby, right? So I think there's also that human aspect that is absolutely irreplaceable. And there absolutely is space for that. And I think we're all eager for that to happen. So I think that'll be the shift that happens, which is what is the balance between the technology and the balance between keeping that humanity and that people aspect that we do lose here on Zoom, right? So that's the struggle. I think that's more going to be, what does that look like, which will be, which we'll all see how that plays out.
And what about, one of the key pieces has been telehealth, right? And telehealth has exploded this year and has drastically changed, the way we do things. And, I want to spend a few minutes on this, because I think the question is not about whether telehealth will stay, right? The question is about who's going to pay for telehealth. And I think as an employer, and as a small business, it's sort of a key piece, right? Right now, you have all these emergency declarations. You have so much access to telehealth. You've got doctors who can practice across states. And yet there's a part of me that wants to pause and ask the question of, will that change, right? Because all of a sudden now, you've got this great technology, but you also are paying for many people the same rates from telehealth that you would do for in-person visits. So as an employer thinking about benefits and employee health, and particularly related to focus on telehealth, do you think that the way telehealth is paid for will change in the future?
Sure. So again, great question. So one of the big things, I'm going to answer that in a different way. So one of the things that's come out of this pandemic is the things we've been telling our patients for a long time, right? Which is don't come to the emergency room unless it's an emergency, right? Which means that if you got a gout flare, if your blood pressure is a little high, don't come to the emergency room, right? Call me, call you. Let's manage that in the office, and now let's manage it on a telehealth visit. So I think that shift has happened in patients where they're saying, do I need to go to the ER? And this isn't the first crisis where we've seen that, right? Having been on call in George Washington and DC, when it snowed, in Miami, when there's a hurricane, nobody comes to the emergency room in the middle of a crisis unless it's an emergency, right? Unless they're stroking out, unless they're having a heart attack, you are certainly not seeing an ear infection in the ER like we were before, right? Like we do when there's not a crisis, because people go to the ER because it's quick, it's easy, they have access, and they don't have a primary care doctor, nor have they bothered to get insurance in many instances, right? So I think that shift has happened. I think we're also seeing a consumer that has said, gosh, I can get my flu shot at CVS. So maybe I'm not going to go to my primary care doctor. Right now I have this really accessible, easy service. So while I'm picking up eggs and milk, I could just get that done for my family. So I think that we've now shifted kind of the competition, right? The hospital systems, docs that worried about the doc down the street, the hospital system down the street. We now have a consumer that's like, there's also a CVS down the street. And there's a telehealth doc available to me at any time, anywhere. Why should I even go anywhere, right? Because I'm the consumer, I'm the one paying for the service. So why not on my time and on my dime, right? So I think that's the shift that we're going to see evolve. I don't think it's a bad thing. I think there are things that telehealth has enabled us to do, which is, access. I need a prescription. I have a question. All of the things that our patients, missed out on because they had to wait 3 months for an appointment or 6 months, or just the personal kind of sacrifice they have to make in missing work, transportation time, waiting room time, all of that. I think everyone's seeing the advantage of that, right? The payers, the docs. The question is, how do you maximize that, and how do you also decide, what kinds of visits should be done virtually and therefore paid for, versus those that can't, right? Your wife is having a baby. She's going to have to go to the hospital for that, right? That is not a telehealth visit, right? All those physical exam visits, all those ultrasounds. I want to be careful that we also realize that, yes, it should be reimbursed appropriately, but there is also a time and place for the physical brick and mortar visit. I will tell you as a rheumatologist, I do not want my patients at CVS, right? Rheumatoid arthritis combined with diabetes and hypertension, really complicated. Not something that I want the average bear on a virtual visit treating my patients for, nor at CVS, because likely they're not going to see a rheumatologist, and likely their diseases and medications are very complicated. And then by the time they do see me, somebody's kind of messed with the recipe, right? Somebody's kind of messed with what we were cooking in the kitchen to get to the goal we wanted. So I think that's really more the question than the reimbursement. I think the payers will have a really hard time. I think the government will have a really hard time putting the genie back in the bottle. I do think telehealth is here to stay. Perhaps there will be some emergency measures that are pulled back. There might be state licensure issues that are pulled back. Certain disease sets, reimbursement levels that might be pushed back. But I think a big part of it's going to be incumbent on the consumer as well as on the physicians to educate and advocate our policymakers and those deciding these reimbursement guidelines, because there is enormous value in telehealth, but there are also enormous limitations. And we as a medical community need to help inform that. And I think consumers are just not going to take it, and if they can't get it with their doctor, they are going to go to CVS and they are going to go to Walmart. And so the question is, what is the right visit for CVS and Walmart? And what is the right visit for a doc like you or me, both in person and brick and mortar? And what should that payment and reimbursement look like?
So here I am, I'm a small business owner. How do I design an employee health program? And just, do you have a few resources that, small business owners can go to even think about how they approach an employee health program?
Sure. I think from everything I know about you, at least it's something, you're enormously well-versed in this area, and you're also very resourceful. I think this is the time for creativity. Sitting down with a few employers, asking them what their pain points are. I can tell you the number one pain point is safety. How do you keep, your employees safe and virtual and kind of this virtual world that we're in? I also would say that look at the low-hanging fruit, right? So we're in flu season, right? So coming up with a plan for, how do you help employers right now deal with flu season? what can you offer in the way of managing that? And I know everyone has forgotten about diabetes, hypertension, and asthma, but they're still there. They're still here. So what is sort of that patient journey that you can often offer for those top chronic diseases that are often responsible for folks missing work, now missing work virtually, and also very costly because you can only miss so many visits and so much lab work before you are going to land in an emergency room, right? COVID-19 or not. So I think they're being very thoughtful about that. And also knowing that employers kind of patient population, right? We call it population, they're going to say employee population. Is a young workforce, an older workforce, predominantly male, predominantly female. So coming up with what those services you would offer would be catered to that employer, right? Often the young millennials, invincibles, are not thinking about the flu shot, are not thinking about what happens when they have an emergency or if they got COVID and actually can, of course, end up in the hospital in the ICU. So coming up with those kinds of services and tailoring it to employers, I think this is the time to do that. I would also say it's a partnership right now. So letting the employer also lean with what their plans are, what are they thinking about going back to work and how you can help empower that and what that looks like as this continues to evolve through the pandemic.
Yep. And, you know, sort of the last clinical question from my perspective, you know, you hear people talk about the flu shot this year is more important than ever, right? Because there's so much overlap between some of the flu symptoms and COVID symptoms, and that, you know, the flu can present with pneumonia as well as, you know, shortness of breath and so forth. What's your advice to employers as they think of a flu program for their employees? Some have gone to mandate it, some not yet. Do you have a take on that as to, you know, when you think of safety, what employers should think about?
Sure. So I think education and awareness first and foremost, right? And you and I both know, right? You can get the flu shot and you can still get the flu. So because you get the flu shot, it also doesn't mean you're sort of golden, right? So also keeping in mind that you're still wearing a mask, social distancing, washing your hands. By the way, that's going to help prevent COVID-19 and the flu. We might even do better this flu season if people do what they need to do for both viruses. I think education first and foremost, make it easy. Obviously, this should be paid for. Being aware of if you do have a certain geographic zip code that most of your employees are in, you know, drive by flu shots. Not a bad idea, right? Just like we've seen with COVID testing. When we get the COVID vaccine, I'm sure that's part of what it will look like, right? And or, you know, coming up with creative transportation, right? Are you paying for the Uber to go get the flu shot, or are you setting up a station where you're having it available and easy and in a very drive-by, easy, quick way. Also, not everyone can get the flu shot, you know that, right? If you've got an egg allergy, there are alternatives. So being mindful of that. But I would say, and making time for it, right? Saying, hey, everyone's got this PTO time off to be used just to get the flu shot. You get 4 hours off, go get it, go do it. So I think there's a lot of creative things you can do. And it is important, and not just because of COVID-19, but it's really also going to be about capacity. Every flu season is hard on us docs. Every flu season is hard on pediatricians because there's only so many patients you can see in a certain amount of time. There's only so many beds and ventilators in the hospital. We saw that with COVID. So as we enter flu season, it's about capacity to handle flu patients as well as COVID patients. And again, we want to make sure people are staying out of the hospital unless they really need to be there. So like everything in medicine, an ounce of prevention is worth a pound in cure. And keeping that trust, right? Unfortunately, what's happening with the vaccine over COVID-19 is we were already building this trust, and we're not even there yet, right? We don't even have a product or a vaccine to offer, but you know, with the flu shot, it is a fantastic vaccine. We want to make sure people are getting it. And so good information is so important right now in an environment where there's so much bad information. So I think empowering that, and ultimately, I still always say it's an individual decision, individual family decision. So the person you want to make this decision with is your doctor, right? So some folks who said, I had this horrible reaction to the flu a long time ago, and I was told never to do it again. Maybe it's time to revisit that conversation with your doc or your pediatrician. You know, what exactly was that? And again, there are real allergies with the flu shot, so being mindful of that, and just and wherever this vaccine lands with COVID-19. You're going to make that decision with your doc, I hope, right? You're going to weigh out your individual family risk, because with any vaccine, there is a risk. There's going to be some side effect. There's going to be something. There's going to be some caveat, just like we have with the flu. If you're allergic to eggs, you fall into a different category. So make the decision with your doctor. Now is the time to have a relationship with your doctor and pediatrician before anything happens, before you're sick, or anyone in the family is sick. Now is the time to make that visit. Make sure you've got insurance. Put aside money in your HSA if you haven't, or find out if you're eligible for one. So this is the time to prevent. September is that time. So just being mindful of that.
Alrighty. So if you had to give 30 seconds worth of pearls of wisdom for employees in Connecticut on thinking about employee health and technology, what would that be?
Oh my goodness. I think I just did that. I feel like I just did that. First and foremost, health is wealth. And absolutely thinking about your health before you're sick. That is one of the benefits of this crisis, right? Unfortunately or fortunately, we're all sort of thinking about our health. So I think keeping that top of mind, planning for your whole family, right? We also have kids who've now gone back to college, right? And Thanksgiving and Christmas will be here before we know it, New Year's. So being mindful of as a family, there's a certain risk in the world that we're all living in today. So being very thoughtful about that. Everyone should get the flu shot. Everyone should have that discussion with their doctor or pediatrician if they have an allergy to eggs. Taking care of yourself, thinking through what your plan is going to look like if someone in the family should get COVID-19 or the flu. Is someone going to sort of be with that person while they're in quarantine, particularly if you have young children? What will that look like? How are you going to plan for the holidays? God forbid your college kid gets sick, and other family relatives who perhaps have, chronic conditions or are more at risk. So just putting that family planning plan together, similar to how we do fire drills, right? We do fire drills before we have a fire. So I think that this flu season, this COVID-19, this winter sort of worry that we all have with the two coming together, it's important to put a plan together for you and your family, and make sure that your doctor is quarterbacking that with you if something happens.
Awesome. Well, thank you, Geeta, once again for joining us here today. And thank you to our viewers and listeners for joining us on today's episode of BizTalk, sponsored by Crystal Financial Insurance Services and hosted by the South Windsor Chamber of Commerce. Thank you, guys.
Thank you.